What's your name and what is your role in the university? So my name's Donna. I'm a lecturer on the nursing associate course. My background is adult nursing, so I was a student at Coventry University 7 years ago, and I've joined the nursing associate team as a lecturer. What is the last picture you took on your phone? Can you show us? I can, because it's of my dog. Can I get my phone? Because all of my pictures on my phone are of my dog, because I love him more than I love my kids. Don't put that on the internet. It was my dog in an England hat the other night before we lost. And my daughter, but my dog. What did you want to be when you grew up? I wanted to be an accountant. I heard there was money in accountancy. And then I had my son and went into a care job and fell in love with caring and ended up being a nurse, so completely different. Who or what inspired you to teach your subject? My curriculum lead, Shelley, is the cleverest person I know, and she was the one that really inspired me to come into teaching. What is your experience in your field? So like I say, I qualified from Coventry University in 2017, and I did 6 years out in practice at Warwick Hospital, mainly surgical nursing, but then obviously COVID hit and elective surgery stopped, so I was redeployed to the COVID wards, and I worked on COVID wards for a year before I joined the team here. What do you love most about teaching? I think it's the students. I think coming from nursing, where you're caring for people day in, day out, into a teaching role, people say to me, don't you miss that contact with your patients? But I don't, because I kind of have that same relationship with my students. I want to support them, I want to see them succeed. So the students absolutely make my job. What's your teaching style? I try to be quite relaxed. I like the students to be involved in... I don't like to be stood at the front of the classroom with a PowerPoint. I like to get the students really actively involved in what we're doing, flip the classroom, allow them to be the teacher, so go out and do a bit of research on something, feed it back to the class. And I absolutely love live debate. It's a really fun tool for learning, where they can put forward their ideas and bring it to the classroom and debate their ideas. I really like a live debate. Do your students sit in lectures all day? No. So we have apprenticeship students and we have direct entry students that come in through UCAS, and they do it a little bit differently. So our apprenticeship students come in 1 day a week to university, and they're out in practice in NHS trusts for the rest of the week. And then our UCAS students, it's a blended approach to their course, so they do 50% self-directed learning and 50% in university in theory and placement blocks. So when they're in university, they are with us a couple of days a week, and then they go out into practice and apply all of those skills into the ward setting. What is your favourite course module and why? It has to be the law and ethics module for me, because that's my module. I'm the module leader for it. And I remember being a student and it being really daunting, the law and ethics module. And so when I started with the team and it was given to me as my module, I was a bit worried about it. But I think that I've developed it so that the students don't come away with the same fear that I went away with when I was a student. As a student, I'm worried about the academic workload. Should I be? You should never be worried about academic workload. That's not what we're here for. We don't want you to be worried. We've got so many support systems in the university that can help you if you're struggling with academic workload. So you have your module leaders, you have your course directors, you have the wider academic team, and then we have people like our success coaches who would be able to plan your time with you. And we've got the Centre for Academic Writing as well in the library that can help with some of that pressure, hopefully. Just ask. What's your favourite piece of kit you teach with? I think the favourite thing that I use is in our skills labs. We have I don't know what they call it, a simulation doll. And we can simulate anything a normal patient would have in a normal ward. We can simulate with this mannequin, so we can increase blood pressure, increase heart rate, we can catheterize it, we can cannulate it, we can get it to talk, we can change its breathing. And what I really like is because it's in a hospital ward environment, the teaching is really true to life, so that when you go out into practice then, it feels familiar. It shouldn't be as frightening for you because we've done that safe simulation in a ward setting in university. What difference do you think your subject area makes to the world? I'm hoping a good one. Yeah, nursing's really important, and I think, you know, our students are amazing, and they go out into practice every day, and they apply the learning that they've done here in the university in a real way. But I think nurses can make a massive difference. If you've ever been a patient and you're on a ward and you're poorly and you're frightened, the nursing staff are the ones that are there to support you. They care for you, they look after you. So I think we make a real difference to the world. What has your most successful student gone on to do? So we've just had feedback from one of our former students, and she's just been in Tanzania for a month, and she's been working in a hospital in Tanzania, and she did a little bit of fundraising before she went, and she raised enough money to be able to buy a defib machine for the hospital there as well, and some extra supplies. And it just shows nursing, you can do anything in nursing, you can go on to anything. I never thought when I finished my nursing degree 7 years ago that I would be here teaching, but the world really is your oyster with this qualification. It's amazing. What would your advice be to your 18-year-old self when picking a degree? Probably that you're going to be working until you're way in your 60s, so you need to pick something that you really love. I'd think about the campus as well. I mean, I didn't travel far for my degree, and I was born and bred in Coventry, so, but my son, I don't know whether I could talk about my son is just finished his first year here at Coventry University, and actually as a parent of a child that attends the university as well, I just think the campus, the facilities and things are almost as important as the degree itself, the support services that people that are in place here at the university. So have a look at that. If you're going to an open day at different universities, have a look at what support services are available to you, who's going to be there over the 2 or 3 years of your course, because that's really important.